want to invite a couple of folks to the stage to join me here. Dr. Cary Presant, founder of MOASC. Cary. As you recall, this is MOASC's 35th year, and we're incredibly excited for all the incredible developments, and none of this would be possible without him. And I also wanted to welcome to the stage one of our emeritus members of the board, Dr. Bob Moss. Bob, are you nearby? Bob's made incredible contributions to the group and has been a longtime friend of MOASC as well, and clearly also is very responsible for its growth. And just as we begin our presentation, I'd also like to welcome Dr. Edgar Braendle to the stage from AVEO Oncology. Dr. Braendle is incredibly humble. He's the Chief Medical Officer of AVEO Oncology, and I have to say that AVEO has been such a tremendous supporter of MOASC. We approached them about 4 years ago now with a request to start a Young Investigator Award. And I have to say that, it was a pretty far-fetched request, but without, really much hesitation, they were able to expedite processes to secure a 3-year appropriation for this grant, which is now going to be announcing its third winner, in fact. So thank you so much for that. And I have even better news. Dr. Braendle and the AVEO team have actually invited us to award another 3 MOASC Young Investigator Awards for the next 3 years, which is just terrific. Thank you. Thank you so much. So, with that background, I wanted to hand the microphone to Dr. Presant for just a moment to really, sort of describe the role of MOASC in the medical oncology community here in Southern California. And after that, it's really going to be my deep honor to present the MOASC Young Investigator Award this year.
First of all, thank you to all the sponsors for stepping forward. Thank you especially to the sponsor for our Young Investigator Award. And thank you so very much for continuing that award. It will be excellent. Thank you to everyone for participating. It's been an excellent program. Thank you for the program committee doing so well. MOASC has a special role in the community to foster access to care in our community through both our members, our institutions, our fellows and trainees, through Sacramento, through the organizations nationally with whom we work, ASCO, ACCC, ASH, and these organizations, NCCN, all play a major role, and we're happy to play a role together with them. I encourage all of you to continue to support MOASC. To those who have not yet stepped forward to participate with us, joining a committee, joining the board, I encourage you to do so because it can be very, very fulfilling. Certainly doing research, as you see represented on the posters, as you see represented with our Young Investigator Award, helps to fulfill people's careers and make certain that their careers in oncology really continue to be fostered and continue to be exciting and a lot of fun. So thank you all for being here. Thank you, Monty, for doing such a good job.
And I would be totally remiss if I didn't give Dr. Braendle just a moment to talk about AVEO's commitment to fostering our next generation of oncologists. I have to say I've been a part of some of the pivotal studies of tivozanib and renal cell carcinoma, and one of the things I really appreciate about your company, besides the relationship that we've forged, is the fact that on multiple occasions you've allowed me to put my fellows and junior faculty first when it comes to publications and outputs from your trials. So thank you for that, Dr. Braendle.
Yeah, thank you very much, Monty. I think for us at AVEO, it's enormously important to support this award, because I think it's important to foster and support our young investigators. And I think this is our next generation of scientists. These are the people who will drive the science in the future. And I think that's important for us all, as well for our patients. So thank you very much.
And now, without further ado, it's my pleasure to introduce Dr. Arjan Gower to the stage. Dr. Gower. Dr. Gower had a truly outstanding application. In point of fact, we received many outstanding applications for the award. Dr. Gower is actually being mentored by Dr. Eddie Guerin, who happened to be my fellow when I was a resident at UCLA many, many moons ago. And Dr. Guerin has, of course, gone on to become an international superstar in the area of lung cancer. It's wonderful to see that you're going to derive outstanding mentorship for him. So you have a very interesting proposal around datopotamab deruxtecan and lung cancer, right? Do you want to tell the audience a little bit about it?
Sure. So, well, first of all, thank you very much, and thank you for the members of the selection committee for selecting me, and thank you for the folks on the stage for support. It's truly an honor, and I'm really grateful to receive this Young Investigator Award to kind of support my research moving forward. My research is focused on predictive circulating tumor biomarkers in antibody drug conjugates, or ADCs, in lung cancer. Now, ADCs, or antibody drug conjugates, are increasingly being utilized across all tumor types, but really predictive biomarkers of response remain very limited. My proposal is really looking at a novel predictive methylome signature in using blood from patients on treatment to look for predictive biomarkers of response to datopotamab deruxtecan in advanced lung cancer. I think my colleagues, Aaron Lisberg and my mentor, Dr. Guerin, has been heavily involved in the clinical development of datopotamab deruxtecan, and we're able to accomplish this, and we're in a very unique position to investigate this research proposal. So I'm very excited to do this, and I'm excited to present the results in the future.
We at MOASC would like to present you with the official plaque designating the Cary Presant Young Investigator Award. Dr. Presant, Dr. Braendle, can we take a photo with Dr. Gower here?